Yes, I think the new therapies with the high sustained factor therapies and also the non-factor therapies, their purpose is to try to improve efficacy so that there's reduced treatment burden for patients. With the extended half-life products, the purpose has been to reduce the frequency of injection in patients who are still receiving a factor VIII product, but they're able to inject even once a week and have higher trough levels. And so that does provide a lot of flexibilities, particularly for active patients or patients who want higher levels for various different reasons and still have that protection against bleeding. In regards to the non-factor therapies, I think one of the areas that it's really addressed kind of treatment burden is the injections. So with the factor therapies, it's still mostly intravenous infusions. And with the non-factor therapies, it's allowed for subcutaneous injections. So a quicker administration of a product and also reduces the burden of intravenous infusions, particularly in the pediatric population where that's still an issue. And additionally, it addresses the kind of reduced frequency of administration, because with some of the current product we have approved in the United States is emicizumab, and that one can be injected once a week, once every 2 weeks, and in some instances even once every 4 weeks. And then other therapies that are in the process of being evaluated or will be evaluated by the FDAs, some of those can be injected even once every 2 months. And there's also different applications in terms of some that, even though they have to be injected every day, it's a nice kind of dialable pen and it makes administration a lot more easy. So I think with each of these new iterations of novel therapies, it's allowed to address kind of issues with treatment burden, particularly route of administration as well as frequency of administration, and to still maintain protection from bleeding events.